about this gap right here. So we're going to have a look at that. One sec. Okay, so here we are just taking a spinal needle. We're just looking at repairing this anterior horn here. We're just going to probably do a hay bale suture all the way around this just to hold it down. Hold the camera. Okay, just want to show you what we're doing here. We're going to pass this relay and just capture it right there. There's a lot of ways to do this. This is just one slick little way to do it. Okay, so here's our little hay bale suture right there. We're going to try and tie that, and that'll give us some anterior horn stability. That's the plan anyway. We're just tying this right up against the medial capsule. Can I get a mosquito, please? Okay, and so that's going to be it. We're going to go ahead and get you back to the recovery room shortly, okay? Good luck to you now. Bye-bye.